Micah và Dr. Trung Ha xin mến chào quý khán giả của Đài VAE Live. Xin chào Dr. Trung Ha.
Chào Micah, chào quý vị khán giả.
Và hôm nay là chương trình Health and Wellness. Đến với chương trình hôm nay, Đài VAE đã một lần nữa được mời bác sĩ Trung Ha đến đây. Bác sĩ Trung Ha là Board Certified Interventional Pain Medicine and Board Certified Physical and Medicine and Rehabilitation.
Yes.
So Dr. Trung Ha chuyên trị về pain, tức là bị những cái đau. Thì đau tức nghĩa là về xương, khớp xương, bắp thịt hay là gì. Bác sĩ có thể cho biết thêm cái overall what kind of pain do you?
Absolutely. So I focus mainly on musculoskeletal pain. So anytime you have any kind of pain involving your neck, your lower back, your joints, nerves, or muscles, that's something we can help with, and we sometimes help with the migraine headache also. So sometimes people have pain that from the neck, it goes down their arm, which oftentimes they call radiculitis, and we can help with those pinched nerve pain. So muscle, joints, nerves, anywhere you have pain in the body, you can call us.
Yeah, and the last time I asked you, you help people with their financial burden pain, and you are not able to do that.
Yes, I can. Unfortunately, I can't do that, but I refer to Micah for that.
Okay, so the topic today, we're talking specifically about back pain, but even more specific is the lower back pain. Is that what we're talking about today?
Yes, absolutely. So, Mike, let me ask you. Do you ever have back pain before, or do you know anyone else that have back pain?
Oh my gosh, if anybody has a back pain, that would be me. I lived with back pain for so many years, and it's good that I'm doing this programming so that I can learn and see what I can do, or maybe even seeing you so it can help me, or learn so I can prevent it from getting worse. But in any case, yeah, I do. I know that I'm the patients of the back pains, obviously, but I also know everybody. Most of my friends and family have back pain, so it is a very, very problem for most adults.
Absolutely, it's a very common condition for people to have lower back pain, and they can just wake up with it and have lower back pain for unknown reason. And sometimes we call it non-specific lower back pain. So typically, what do you do at home when you have back pain, or what should you do?
So would that be because they sleep wrong, or the position that they sleep wrong, or different mattress, or is that how their back pain hurts?
It could be a whole variable factor. If they have underlying degenerative changes, and let's say they sleep the wrong way overnight, that could cause inflammations. It could cause like a myofascial trigger point that can, they call muscle spasm kind of.
Yeah.
So that can happen if you have low back pain from, let's say, a heavy lifting injury.
Oh, yes.
That could cause like, disc bulge or herniations or nerve injuries.
Yeah.
But typically people don't know what to do when they first get back pain. I mean, what did you do when you first got back pain? What did you think about?
Well, I complained, and I tried to maybe take pain medicine over the counters. Maybe I massage myself, or have someone that helped me to massage a little bit to help the tensions. Taking, like maybe even cool ice, maybe apply cool ice. I have done that. I've done cool ice. I've done hot pads. And just relax and not overwork my back. But obviously, I just take over-the-counter medication. Is that something that you would recommend one to do?
Absolutely. And, if you just have back pain from normal day-to-day activity, like, you wake up with back pain, or, you lift something like 5-10 pounds, or light weights, you have back pain, or let's say you're playing sports, you have low back pain, you work out, you injure yourself somewhat. Initial steps I would recommend, just take it easy and take over-the-counter medications. And some of the medications that you want to focus on is anti-inflammatory medication,
yeah.
which can include, but are limited to, like ibuprofen, which are Advil, Aleve. And if you want, you can take Tylenol for pain. And like you say, you can buy some topical ointment you can put over your back.
Okay.
That can be Biofreeze,
like icy hot,
yes. Or like. And Biofreeze and even Bengay.
So what is better, the ice pad or the hot pad?
It depends on how you like it. Ice kind of cool things down a little bit.
Yeah. That helps to
decrease the inflammation.
That's right.
Some people like heat. It
Yes.
doesn't hurt either or,
Yeah.
but you don't want to be on heat for too long because
Yes.
you can cause skin changes.
Yes.
But try the conservative care, meaning do what you can, just relax your body. Still walk around, don't bed rest, and take the over-the-counter medications, and even get massages.
Yeah.
And if that doesn't work after a few days, or things get worse, and you have pain going down the leg, we're talking specifically low back pain. If it goes down the leg, or you have fever, chills, or you can't walk, then that's when you want to seek medical advice.
Yes. So I know that there are several different type of pain that you have listed here. Can you go over these different type of pain that?
Absolutely. So some of the common pain are like, you have neuropathic pain, which are nerve pain. It can be like general symptoms of tingling, numbness, burning sensation, shooting, electric light. Those are nerve pain. And other pain are musculoskeletal pain, which is like non-specific, vague, dull, achy, sharp sometimes, depending on which position you move to. And so it's just non-specific in the lower back. And other pain that you may have is inflammatory pain, where it can be pretty painful. Like, for example, you have a cut on your hand. That cut itself caused trauma to your skin. That area caused pain already. But the surrounding tissues is very painful if you touch it. Those are inflammatory factors causing the skin and nerve ending to be very sensitive, thus generating a lot of pain and sensitivity. And mechanical or compressive pain, or pain that arises from compression from outside factors, like let's say you have a tumor pressing on your nerves or spinal cord, that can cause pain. Or even if you have like a bleeding episode, they call it like epidural hematoma, or any that can cause pain. And other stuff, if you want to make sure that even though you have back pain, that it's not coming from the abdomen. Because sometimes you have a kidney stone that can cause a lot of pain going down to the front part of the leg, whatnot. That can mimic a radiculitis or a sciatica, And tumors can cause pain, so you want to rule out all those severe conditions before you just leave it off.
My back gets worse from hearing all of this stuff, hearing all the kind of the different kind of pain that just make me feel even more painful. Well, I did not know that there's so many factors on this pain. So can you tell us that if one that's suffered the pains, and they can take medication over the counter and obviously doing the stuff at home that not working, and then they have to come to see you, what would you do, how would you do to help them to minimize the pains?
So if you're unfortunate enough to get back pain that does not get better with conservative care home remedy, if you come to our office, our goal is to kind of get you to be pain-free as fast as we can. We're trying to prevent acute pain or subacute pain from going to chronic. So we have about 3-month window to do that. So when you come in, we're going to take all your history, medical history, including like history of cancers, history of rheumatological conditions, any family history. And then and when you see me, I'm going to do a very nice history in terms of asking you, how did the pain happen? What type of pain is it? Does it shoot anywhere, or does it go anywhere? What makes it better? What makes it worse? Pain intensity level. What have you tried that works for you? What you tried that didn't work? That way we kind of put a picture together. And if I get a history, I'll do an examination on you, and a very detailed neurological examination to make sure we don't miss anything. That can we call red flags. So once we do that, then I discuss with you in terms of what I think your condition is, and kind of go over the anatomy with you and what I think it is and what is the next step. And together we'll come up with a treatment plan. And typically, if it's, let's say, no red flags involved, and you're functionally stable and you don't have any neurological change, then we'll probably treat you conservatively first. Of course, start with you with like anti-inflammatory medications, maybe steroids, dose pack, some muscle relaxer, topical analgesic, maybe some ice and heat to kind of help calm things down for you, and get you with physical therapy or chiropractic therapy to kind of help get you mobilized again, get you moving. We don't want you to just lay there all day long,
right.
you know?
Yeah,
so we got to get you moving, increase the blood flow to the area, and get you active, slowly regain your strength, and then reevaluate you.
Yeah, I see that you got the spine illustration here. Can you tell us a little bit about nerve pains and different kind of pain that so it's more specific on this.
Absolutely. So what I have here is a spine model, and this is the bony model of a spine. So here we have the back of the spine, and from the side view you can see that you can see the side and front view. You can see the vertebral body of the spine. So if we talk about low back pain, there's 5 vertebral body: 1, 2, 3, 4, 5. And as you can see, between each vertebral body there's a disc. And this is called this disc can cause a lot of conditions for that involve low back pain. And oftentimes when people have pain, it arises from the disc, lead to have a herniation or disc bulge. I'm pretty sure you hear all those terms before.
Bulge, right.
And if you go to the side a little bit, these are the spinal nerve roots, and it goes down, and when it goes down, it combines together with the sacral nerve roots down here, and they form what we call the sciatic nerve, and that sciatic nerve go down to your leg. And when you have pain, one of these nerves get pinched by the disc, you have pain down the leg, we call sciatica, or people call sciatica, but in medicine we call it radiculitis if it's acute, or radiculopathy if it's chronic. And then, so those, when the nerve get pinched, if you go further into the back, so I'm just going over all the area that can, we call pain generator. The other part can be the facet joint, which is a very common pain generator. And people tend to get this after like acute injury, like whiplash injury, involving the neck, but also low back, like in a motor vehicle accident. You know, the acceleration, deceleration force kind of cause you to have inflammation in this facet, or you have arthritis over this facet from working hard. You know, I'm pretty sure you may have some of that because of all this years hard labor work, and that can cause pain also. And over here, inside here, there's also soft tissue like ligaments and phlegm, blood vessels, and ligaments surround soft tissue that can cause pain also. And if you look inside this yellow thing, that's you see that? That's the spinal cord. Right. So the spinal cord run inside the spinal canal, and it has room to wiggle around. Oftentimes when you get older and you have arthritis, what happens is that it gets smaller and smaller, so it has no room. So because central canal stenosis, that can cause pain because you squeeze in the spinal cord. Right. And that can cause, all these conditions can cause low back pain, but when you start involving nerve pain, you can have the burning, tingling numbness going down your leg, and you can't walk. And we're talking about this herniation, which is one of the most common conditions that happen. It's, you lift something heavy, like 50 pounds, and you hear it pop, and then you can't walk because it's so painful, because combination of this herniation, releasing a lot of cytokine and inflammatory factor, in addition to the compressive force that it causes on the nerve. So if you look at this spine model, so this is a short segment, we'll call it L4, L5. L4 is the vertebra number 4, and L5. And this red structure right here is the disc. Now, if you look at from the back, if you have this herniation, this is what it looked like. It popped out, and you see how it can press on that nerve root?
Yes, it has to go somewhere.
Yeah, it has to go somewhere. Typically, it goes posterior lateral, so which is this angle. And when it goes to that angle, if it's big enough, it can press on that nerve root. And when you touch that nerve root, you're going to have that pain on the leg, and you get scared, you know? You don't know what to do.
Does it also like happen on both sides?
Oh, mostly one side, but then if it's big enough, it can happen like throughout the disc.
And so it presses on the nerve, and it goes down to your leg, so you feel the numbing, the numbing sensations. So when I have my legs hurts, then I know it kind of where.
Absolutely. So if you have pain, low back pain, and it start going down your leg, and you can't walk, serious, and you can't feel it, or feel numb, tingling, your sensations is abnormal, I would suggest come see a pain physician so that he can evaluate you.
Right. So what do you do that? Do you do surgery that, or how do you make it so that it won't compress down?
So our goal in our clinics to prevent surgery from happening and to get rid of your pain as soon as possible and not prevent it from going chronic. So what happens when you come to me, we evaluate you, treat you, I'm going to let you try those conservative measures for about a couple weeks and get you to start physical therapy. If that doesn't work, or your symptoms start progressing a little faster, then what we can do is we can offer procedures. And these are not non-surgical. It's interventional pain procedure, which a lot of people don't know what it is and have bad experience. They get scared. But it's kind of like, so let me talk about the most common one. It's called the lumbar epidural steroid injections. And just like for pregnancy, you know, females, they get an epidural so they can deliver. Same thing. But this time, you know, we use an X-ray machine, fluoroscopy machine, to help us localize the anatomy, and so that when we use the needle, it's right where we're at.
Right.
And we have technique that is very safe.
Yeah.
Complications are
Very
very
accurate.
rare, very accurate. Complications are rare nowadays, but it can. That's why you want to go to interventional pain physician who is board certified and trained in a medical institution that teach them all the right technique and proper, steroid technique and stuff.
Well, after seeing the model, then I can see that how serious back pain is. It can certainly help worsen the nerve pains and the joints and the bones and deteriorations of the nerves and the bones, and it can not only affect the back but also affect the rest of your body, and it's not fun.
No, it's not. I mean, now you're talking about functional limitation that it causes.
Right.
You gotta also include psychological stuff.
Take off work.
Take off work.
Family.
You can't pay rent.
Yeah.
You're not happy around anybody. Nobody want to be around you because you're cranky. You know.
Yes.
So that's why we gotta address this very seriously. Because if not treated appropriately, it can lead down to chronic condition, which you don't want to.
Well, thank you very much for the illustrations and more specific about different kind of the cause and the reason why the back pain, and also the possible treatments to help these. And I certainly learned a lot today, and I hope that that you guys learned a lot today. And also, if you ever need someone to help you with your back pain, please find some way to get help from different doctors, or even Dr. Ha here can help you with your back pain. Could you please tell a little bit about your company so that the audience know where your office is and your contact information?
Absolutely. So my clinic is called Quantum Interventions, Quantum Pain and Sports Medicine, and we're located in Irving, Texas. And our goal is, like I said, prevent acute and subacute pain from going to chronic. And we take a very holistic approach to your pain care. And we try to minimize you or decrease the chance of you getting surgery. And after you completely recover, we'll show you how to, do preventive measure, how to take care of yourself and your body, ergonomics, teach you exercises that can help you prevent from relapsing, and stay and live a healthy and pain-free, functional life.
And you are board certified intervention pain medicine doctor. And can you give your contact information, your website and phone number?
Absolutely. So I'm board certified, graduate from the Cleveland Clinic Foundation's fellowship program. I did an anesthesia pain fellowship program there in 2017. And our website is, you can check us out on quantumpainsports.com. And if you want to come over to see us, then you can call 469-913-6136, and we're more than happy to take a look at you.
Fine. So if you do suffer the pains, either the skeleton pain or muscle pain, or please seek some advice from different doctors or even Dr. Ha here. And we are so thankful that you could come and give us a little insight about the back pains, and I hope that you can come back and give us more different kind of pain so that one can learn and prevent. And health and wellness program đến đây cũng xin tạm dừng và hẹn gặp quý khán giả trong chương trình kỳ sau. Cảm ơn bác sĩ Trung Ha một lần nữa và hẹn gặp lại trong chương trình tiếp theo.
Cảm ơn Mike, cảm ơn quý vị. Bye bye.